The flu season is upon us, and many students find themselves in danger of contracting the virus. There are many things to watch for in order to avoid catching the flu.
The best thing to prevent from getting sick during the school year is good hand washing. Wash with soap and water, and if you're not available to have soap and water, hand sanitizer is the next best thing.
Be aware that the virus can live on surfaces for several hours, so if they're in a class or going to the bathroom after that, just make sure you wash your hands and try to eat healthy and get enough rest and exercise, which sometimes is hard for college students to do.
Usually what I do is I always try to wash my hands whenever I get done touching anything, that's public, like a handle or anything, anytime I go to the bathroom, I wash my hands. I try to take a lot of vitamin C. My grandma always tells me that's good. It keeps you from getting sick, so.
The flu virus itself thrives in the winter weather, making it difficult for students to avoid the illness.
During the flu season, it's October to May, and February being the peak of the season, and it's the cold weather that usually the flu is more conducive in.
It's actually the virus itself is more stable in the winter, so it's more easily spread.
If you or your roommate have already contracted the flu, here's what you can do to keep your environment sanitary.
If someone that they live with or are around is sick, then they need to stay away from them and just be aware that being around them, if that person's sneezing or coughing, that they can get it from just the air.
If they're in their suite or room, I would Lysol down or wipe down items with a antibacterial wipe.
Esri Health Center provides free flu shots to students, as well as other health and wellness services.
Students can get the flu shot here at the Esri Student Health Center. We offer it free for all students starting October 1st and going through the flu season. We get plenty of doses to support the students.
You get your flu shot beginning usually about October, and it makes you build immunity towards those strains of the flu that we think are going to be the most prevalent that year.
I haven't gotten a flu shot in a long time actually, so that's why I decided to get one today, because I figured a lot of people are getting sick this year, so I wanted to take the precautionary measures in order to not get the flu. So yes, I decided to get my flu shot, but I usually don't get it.
There are some misconceptions surrounding the flu shot that actually prevent students from getting it, which the Esri Student Health Center has offered to clarify.
So a lot of people say that the flu shot makes them sick. The virus is actually not a living virus, so the fact that they say that is not very likely.
The flu shot does not cause you to get the flu. You've probably been exposed to something prior, if that were the case, before you got the flu shot.
It's a myth, or it's their way of saying they don't want one.
In addition to the flu shot, there are a few things you can do to boost your immune system or ease the symptoms of the flu.
They can be prescribed Tamiflu, and that could help protect you and get over the symptoms quicker. But if it's after a certain time, basically rest, increasing the fluids, good hand washing.
I'll take probiotics, and it's only the good bacteria that's in your body. And I'll also take prenatal vitamins, because even though I'm not pregnant, prenatal vitamins have a lot of different nutrients in them.
Producer Jeni Swope asked students in the Blum Union how they prevent the flu, whether or not they support the flu shot, and what they do in case they get ill.
I'm kind of just washing my hands and coughing in my shirt.
The best way not to get sick is not to get around sick people, right?
I definitely wash my hands a lot, especially if I get around someone that's coughing a lot.
I don't usually touch public things. I don't like using public bathrooms. So.
Flu shots are usually a good idea. I know a few stores around here do them for free.
I get the flu shot yearly at the end of the year to keep me from getting ill in the wintertime.
I have not had the flu shot yet. I should probably go and get one real quick.
This year I didn't take it, so I've actually got sick multiple times. I don't know if that's just the campus air or just me.
I just get a lot of rest, mostly.
I take the basic cold and flu medicine, but I don't go to the doctor or do this unless it gets, really bad. Other than that, I just, let it kind of cure itself a little bit.
Sleep, drinking just, juices and such, and trying to eat fruit mostly.
Catching the flu can really put a damper in the semester. With a few simple prevention methods, students can remain healthy throughout 2015. For Jeni's Swope, this is Christina Wade with Griffon Update.